Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu.
Hi, I'm Dr. Kenny Levine. I'm here with Dr. Jay Singer, orthodontist to the stars. Jay, oh, I'm a star.
Well, thank you. I have treated a few stars and a few Playboy centerfolds, I may add.
Have you?
Yeah.
Okay, we're going to talk about that because that's important. Even with the clear, the brackets and the bonding of the brackets, there are some patients of yours who don't want their braces seen. What do you offer that's unique to them?
Well, the first step after direct bonding was direct bonding of plastic braces. Plastic braces had some deficiencies. They discolored, they broke. Then they went to ceramic brackets, which was tooth-colored and white-colored wires. So the step towards, well, the evolution towards a much more aesthetic appliance took a giant leap. And then in the mid-'80s, lingual orthodontics was developed.
Lingual meaning inside
lingual
the teeth?
Lingual means referring to the tongue. So lingual appliance is an appliance behind the teeth.
Which is not visible from the outside.
Totally invisible. And actually, I jumped right on that bandwagon. I took the lingual course in the mid-'80s, even early '80s, and I've been doing lingual orthodontics ever since. And there's been an evolution of those appliances as well. And then, of course, the latest in the last few years has been the Invisalign appliance, which is a totally non-fixed, removable appliance with the Invisalign trays.
I want to get back to the lingual braces for a moment. Is it more difficult to move teeth with those appliances than with the traditional ones that are between the teeth and the lips?
Well, it's a little more difficult. The distance between the brackets on the inside, since you're now on the inside of the circumference,
smaller, is
a narrower interbracket distance, which limits you mechanically. But most of the principles are the same, and most of the treatment that you can do with a labial or lip side appliance, you can also do with the lingual appliance. So there's very few contraindications to a lingual appliance.
People want things done quickly. They want instantaneous. Tell our viewers why you can't move teeth too quickly. What happens?
Well, a tooth movement is really a biological process. So you're limited by the biology. And normally, bone is softer than cementum, which is what roots are made of.
Bone is softer
So
than teeth.
normally, you move a tooth and the bone resorbs. But of course, if you apply too much pressure to a tooth, you can get what's known as root resorption, where actually you can lose some root surface. So it's very important for the orthodontist to keep that paramount in all of his treatment. And so you're limited by the biology and how fast you can move a tooth.
You mentioned the removable Invisalign or other type of appliance. Talk a little bit about that and the limitations of that and the training that's needed.
Well, Invisalign is a totally different technique. It's a removable technique. Now, any removable appliance, you don't have quite the control that you do with a fixed appliance.
Right.
But Invisalign incorporates what's known as attachments. These are little bonded mounds on the tooth that holds the Invisalign tray, which is a clear U-shaped or horseshoe-shaped tray that fits over the teeth, as you know. And the attachments hold those trays in position, and the design of these attachments has really dramatically improved over the years. They've come out with a lot more sophisticated design of different kinds of attachments to do some of the things with an Invisalign removable appliance that we couldn't do in the past, such as rotation, root alignment, torquing of roots in the front to back position. So with the attachments, our scope has really enlarged with Invisalign, but still not to the same degree as you can with the removable appliance. We still can't really treat extractions well with Invisalign treatment, but it's improving still, and there are techniques, what we call hybrid techniques, where you do some of the treatment with a fixed appliance and then you finish the case with an Invisalign.
If you had two cases that were identical and they needed complex movement, one patient insisted on Invisalign and one patient agreed to the fixed appliance, which would be a quicker fix?
I think the fixed appliance. And so if it's a more difficult case, we encourage lingual or clear. If it's a more complicated treatment on the bottom and a little easier treatment on top, we can do Invisalign on the top and a fixed appliance, or clear or lingual on the bottom.
We're going to get back to one of the things we have to talk about is retention and stabilization. We'll get back in a moment. I'm Dr. Kenny Levine with Health Talk. We'll see you in just a couple of minutes. Thank you.